Are you waking up 2, 3, even 4 times a night just to pee? That's not just aging. It's a red flag. Your prostate may already be swollen. The real problem? Your bladder can't fully empty because your prostate is silently pressing on it. In this video, I'll show you the 3 early signs of an enlarged prostate, 1 critical mistake to avoid at night, and 3 simple changes you can make today to sleep through the night again. I'm Dr. Dash, men's health expert with over 30 years of experience, and we're going to tackle this head-on the right way. And at the end, I'll share 1 natural food that's been shown to calm your bladder and shrink your prostate, so stick around.
Doctor, why do I keep waking up at 2 in the morning to pee? I hear this every single week from men over 60. It's frustrating, right? You fall asleep just fine, but like clockwork, your bladder calls and you're wide awake in the dark, again. Let me be clear, this is not just a part of getting older. This could be the very first warning sign that your prostate is growing. What you're experiencing? Nocturia. That habit of waking up once, twice, or even 3 times a night to urinate? It's called nocturia, and it's not normal. According to the Cleveland Clinic, over 70% of men over 60 with early-stage prostate enlargement experience nocturia as their first major symptom. Here's what's happening inside your body. As the prostate grows, it starts to squeeze your urethra. That pressure prevents your bladder from emptying completely, which means you feel the urge to go, again and again. Even when you think you're done, your bladder still has more left behind. The hidden cost of ignoring it. You might think it's just a bathroom trip. What's the big deal? But here's the truth. Poor sleep equals poor testosterone production. You'll wake up with less energy, weaker focus, and lower confidence. Over time, chronic sleep disruption leads to memory fog, weight gain, and mood swings. And the longer this goes unchecked, the more your bladder weakens, making things harder to reverse. Common mistakes I see men make. Cutting water entirely after dinner. This leads to dehydration, bladder irritation, and even more nighttime trips. Blaming it on age and never getting it checked. That delays treatment until the symptoms worsen. Overusing diuretics like coffee, alcohol, or certain teas before bed. These stimulate the bladder, not soothe it. What you can do tonight. Here's a simple fix I recommend to my patients. Hydrate properly, just not too late. Drink most of your fluids before 6 p.m. After that, limit caffeine and alcohol. Give your body time to process fluids before bedtime. This small shift alone can cut down nighttime trips dramatically and help your body start recovering. Let's not normalize what isn't normal. If you're waking up at 2 a.m. like this, it's time to listen to what your body's trying to tell you. Ever feel like it takes forever to get your stream started? Or that you're never quite finished? That hesitation, that weak flow, or that burning sensation, it's more than just annoying. For many men over 60, these are early signs of an enlarged prostate, also known as BPH, Benign Prostatic Hyperplasia. What's actually happening? Let me break it down simply. As we age, the prostate, a small gland just below the bladder, starts to grow. This growth isn't cancer, but it pushes against the urethra, the tube that carries urine out. When that tube gets squeezed, urine can't flow freely. That's why you may notice a slow or weak stream, stop and start flow like a garden hose with a kink in it, or that frustrating feeling that you're not fully emptying your bladder. According to the Mayo Clinic, over 50% of men in their 60s have some level of BPH. And get this, half of them don't even realize it until more serious problems start showing up. What happens if you ignore it? If you're brushing it off thinking it's just part of aging, here's the reality. Your bladder works overtime to push urine out. This leads to fatigue and strain. Over time, your bladder muscles weaken, making the problem worse. And frequent urination or painful burning can start to affect your sleep, mood, and even your confidence in daily life. Many men tell me, "Doc, I just thought it was dehydration." But the truth is, this is your body trying to get your attention. Common misconceptions to avoid. Thinking burning means infection. Sometimes it's BPH irritating the bladder, not an UTI. Believing weak flow is just age-related. Age plays a role, but it's not an excuse to ignore symptoms. Holding it in too long, that backfires. It trains your bladder to misfire and makes urgency worse. A simple fix to try tonight. Use the double voiding technique. After you pee, wait 20 to 30 seconds. Relax. Then try again. This helps you fully empty your bladder, reducing trips to the bathroom and giving your bladder a much-needed break. Remember, BPH is common, but letting it go unchecked isn't wise. Small steps now can save you from big problems later.
Doc, I'm up 3 times a night to pee, and I'm exhausted during the day. Is that normal? That's a question I hear from men all the time, and let me say this as clearly as I can. Poor sleep isn't just annoying, it's dangerous. If you're a man over 60 waking up multiple times at night to urinate, you're not just losing rest, you're losing your edge. What's really going on? You see, your body runs on rhythms. At night, when you enter deep sleep, your brain, hormones, and organs all reset. But when nocturia, that frequent urge to pee, interrupts your sleep, that healing process gets cut short, and you pay for it during the day. Interrupted deep sleep has been shown to reduce testosterone production, the very hormone that drives your energy, strength, and libido. Cognitive clarity, making it harder to think, remember, or focus. Heart health, by increasing blood pressure and inflammation. According to the Harvard Medical School, even losing just 90 minutes of deep sleep can measurably reduce next-day alertness and testosterone. Now imagine that, night after night. Why this gets overlooked? A lot of men think their fatigue is just age. Some even get misdiagnosed with sleep apnea when the real culprit is an enlarged prostate keeping them up all night. And too often, I see men try to power through without fixing the cause. But poor sleep is not a badge of toughness, it's a warning light. Common missteps to watch out for. Napping too long during the day. This can throw off your sleep rhythm. Ignoring your bladder's messages until it's too late. Drinking water too close to bedtime. Even healthy herbal teas can be bladder irritants. A simple tip that works. Elevate your legs 1 to 2 hours before bed. Why? During the day, fluid pools in your legs. At night, it moves upward, into your bladder. By propping your legs up early in the evening, you help your body flush out that fluid before bedtime, reducing overnight trips. Sleep is where recovery happens. If you're waking up tired, moody, and foggy, it's time to fix the root cause, not just mask the symptoms.
Doc, why do I always feel like I have to pee, even right after I just went? That question usually points to one thing. Your prostate and bladder are no longer playing nice together. If you're a man over 60, dealing with frequent urges, rushing to the bathroom, or feeling like your bladder is never truly empty, you're not alone. And the reason might surprise you. What's the real problem? As you age, your prostate naturally gets larger. Now, that alone isn't always a problem. But when it starts to press against the urethra, the tube that carries urine out of your body, it forces your bladder to work harder, to push past the pressure. Over time, that pressure causes the bladder to become more irritable, overactive, and eventually weaker. According to the Cleveland Clinic, over 50% of men in their 60s experience urinary symptoms linked directly to prostate enlargement. These include sudden urgency to urinate, frequent urination, even right after voiding, incomplete emptying, causing a constant sensation of a full bladder. Why this matters more than you think. When this link is ignored, it can spiral into bigger issues. The bladder wall thickens from overuse, leading to loss of flexibility. You may start leaking urine or urge incontinence, and you'll wake more often at night, destroying your deep sleep, which leads to fatigue, low testosterone, and even mood changes. What most men get wrong. They ignore urgency. But pushing it off only increases bladder strain. They force the flow. Straining doesn't help. It weakens the bladder muscle further. They drink less water. Thinking less fluid means fewer trips, but it backfires. Concentrated urine irritates the bladder even more. One simple fix you can start today: bladder training. Here's how. When you feel the urge to go, wait 5 to 10 minutes. Gradually stretch that to 15 or 20. Over time, this reteaches your bladder to hold more and react less. It strengthens control and reduces frequency naturally. Your bladder and prostate are in a delicate dance. The sooner you help them work together again, the sooner you'll feel like yourself.
Doc, I keep waking up at night to pee, so it must be my prostate, right? Not necessarily. That assumption is one of the most common mistakes I see in men over 60. While an enlarged prostate, BPH, is often the cause of nocturia, it's not the only reason. And treating the wrong problem, that only leads to frustration and more sleepless nights. Let's break it down. Not all nighttime urination is prostate-related. Nocturia, waking at night to urinate, can come from several conditions that mimic BPH symptoms. Here are a few possibilities I see often in my practice. Diabetes. Elevated blood sugar pulls fluid from your tissues, causing excessive nighttime urination. Overactive bladder. This condition makes the bladder spasm or signal urgency, even when it's not full. Sleep disorders. Sleep apnea can actually trigger nocturia due to hormonal shifts during apnea episodes. Medication side effects. Certain blood pressure pills or diuretics can ramp up urine production late at night. According to the Mayo Clinic, nearly 1 in 4 men with nocturia don't have BPH at all, but they get misdiagnosed and put on unnecessary medications anyway. Why accurate diagnosis matters? If the root cause isn't prostate-related, then treating it like BPH won't fix the problem. And if it goes unchecked, you risk fatigue, brain fog and irritability from poor sleep, loss of testosterone and muscle strength, mood shifts and relationship strain from chronic nighttime disruptions. I've had patients go years without results until we look deeper. Common misconception: all urinary issues equals prostate. It's understandable. The prostate gets most of the attention, but that's exactly why you need a proper evaluation. Pro tip: ask your doctor for these 3 tests. 1. PSA blood test to check prostate-specific activity. 2. Bladder scan or ultrasound to measure residual urine. 3. IPSS, the International Prostate Symptom Score, a quick questionnaire that helps assess severity. If you've made it this far, it means you care about your health, and that's a great sign. But knowing the signs isn't enough. Let's talk now about what you can actually do to take back control. You don't have to guess, you deserve answers. And with the right diagnosis, real relief is possible. Your body is always speaking. You just have to be the kind of man who listens. After 30 years helping men like you, I can tell you this: the earlier you respond to your body's warnings, the easier it is to protect your energy, your sleep, and your confidence. Tonight, if you remember one thing, let it be this: waking up at night to urinate isn't something you have to accept. It's not just age. It's a sign. And it means your bladder, your prostate, or your sleep rhythm may be out of sync. The good news? You can take back control starting now. Try this tonight. Avoid coffee, alcohol, and excess fluids after 6 p.m. Put your feet up for 20 minutes in the evening to help drain fluid before bed. Use the double void method. Pee, wait, then go again helps empty your bladder more fully. Simple, right? But surprisingly effective when done consistently. Now, I don't expect you to fix everything overnight. That's not how real progress works. What I do ask is that you stay curious. Keep showing up. Because this stage of life can still be strong, fulfilling, and full of purpose if you choose to take care of yourself with intention.
And if today's message gave you a new way to think about your health, stick with me. There's more ahead that might just shift how you look at aging for good. Oh, and if this video helped you in any way, feel free to give it a thumbs up, share it with a buddy, or hit that little bell so you don't miss what's coming next. If you found this helpful, watch my next video on 3 natural foods that shrink the prostate without pills. I'll show you what to eat daily for real results.